Paracentesis. Areas examined and treated. Abdomen. Peritoneal cavity. Acidic fluid. Fluid around abdominal organs. The procedure. Diagnostic. This is a procedure to remove fluid from the abdomen. The fluid buildup is called ascites. A needle or small catheter is placed through the abdominal wall. Fluid may be removed for testing. Ultrasound may be used to locate the safest fluid pocket. Therapeutic. A larger amount of fluid may be removed for symptom relief. It may reduce abdominal swelling, tightness, pain, or shortness of breath. Albumin may be given if a large amount of fluid is removed. Before your procedure. Schedule your procedure. Appointment. Schedule your paracentesis appointment with GastroDoxs by phone at 832-632-4070 or in the office. Location. A procedure location will be suggested based on your insurance and geographic area. Please refer to the locations page on our website. Insurance. Our team will obtain the required insurance prior authorization if needed. Financial. GastroDoxs provider fees will be collected upon scheduling your procedure. Orders. Our team will send your procedure orders to the hospital, radiology center, or surgery center. Transportation. Sedation is not usually used for paracentesis. If sedation is used, do not plan to drive after your procedure. You must have someone 18 years old or above to drive you home if sedation is used. No Uber, Lyft, cab if sedation is used. Changes. To cancel or reschedule, call or text. GastroDoxs at 832-632-4070. Register with the facility. NUNT General. A representative from the hospital, radiology center, or surgery center will call you to discuss the registration process, time, and location of your procedure. Clinical. The pre-assessment team will discuss the following: Ascites history, blood thinner, use liver disease history, medical history, medications, recent lab results, financial. Hospital, radiology, anesthesia, and lab fees are independent from GastroDoxs. The other fees not related to GastroDoxs are to be discussed directly with the other providers or facility. If you have not heard from the financial representative 24 hours before your procedure, call them at that time. Clearance. Cardiac hematology, neurology, pulmonary. You may need a clearance if you have high-risk conditions requiring clearance. You may need a follow-up with your doctor or provider before they can issue a clearance. Our team will send your doctor or provider a clearance request from our office. Once our team has your clearance on file, we will call you to schedule your procedure. Blood work may be required before the procedure. You may need a clearance if you are on blood thinners or these medications: apixaban, Eliquis, clopidogrel, Plavix, dabigatran, Pradaxa, edoxaban, Savesa, Prasugrel, Effiant, Rivaroxaban, Xarelto, Ticagrelor, Brilinta, warfarin, Coumadin, and Jantoven. Medications. 2 weeks before. No medication changes are usually needed unless instructed. If sedation is planned, GLP, 1 medication instructions may apply. Tell the team about all prescription and over-the-counter medications. 1 week before. Blood thinners may need special instructions. Do not stop blood thinners unless instructed by your provider. Continue other medications unless instructed otherwise. 1 day before. Oral diabetes. Medication. Follow pre-assessment instructions. Insulin. Take adjusted dose only if instructed. Diuretics or water pills. Follow provider instructions. Procedure day. Blood pressure. Medication. As instructed by the pre-assessment team. Insulin. Follow pre-assessment instructions. Diuretics, water pills. Follow provider. Instructions. Others hold only if instructed. Other. Continue to take your medications unless specified below. Blood thinners will require a clearance on file before scheduling if needed. The pre-assessment team, PAT, will review your medications and may make other recommendations also. Diet instructions. 2 weeks before. Foods. No change unless instructed by your provider. Liquids. Drink water as instructed by your provider. 1 week before. Foods. No special diet change unless instructed. Follow any low-sodium diet instructions given by your provider. Avoid alcohol. Liquids. Follow fluid restriction instructions if you have been given one. So 1 day before. Foods. Eat as instructed by the facility. If sedation is planned, stop food after 12 a.m., midnight, unless instructed otherwise. Liquids. If sedation is planned, stop liquids after 12 a.m., midnight, unless instructed otherwise. No alcohol. Follow fluid restriction instructions if provided. Procedure day. If no sedation is planned, the facility may allow normal eating or light intake. If sedation is planned, no food or liquids unless instructed otherwise. Take medications only as instructed. Empty your bladder before the procedure. Paracentesis preparation instructions. Preparation instructions. Follow facility, arrival, and fasting instructions. Bring insurance card and photo. ID. Bring medication list. Complete required blood work if ordered. Tell the team about blood thinners. Empty your bladder before the procedure. Procedure day. Diet. Follow the facility instructions for food and liquids. Arrival. Please arrive at the time given by the facility. You will check in at registration when you arrive. Pre-procedure. The clinical team will review your medical history, medications, allergies, and lab results. Your blood pressure, heart rate, and oxygen level may be checked. Consent forms the procedure will need to be signed. Numbing. Local anesthetic will be injected into the skin. You may feel a small pinch or burning sensation. The area should become numb before fluid is removed. Position. You may lie on your back or slightly turn to one side. The abdomen will be positioned for safe access. Ultrasound. Ultrasound may be used to locate the fluid. The safest entry site may be marked on the abdomen. The skin will be cleaned and sterile drapes may be placed. Post-procedure. A needle or small catheter is inserted through the abdominal wall. Fluid will drain through tubing into a collection container. Pressure is applied and a bandage is placed after catheter removal. You may be observed for a short time after the procedure. Diagnostic. A small amount of fluid may be sent for lab testing. Testing may check for infection, bleeding, cancer cells, liver-related fluid, or other causes. Therapeutic. A larger amount of fluid may be removed for symptom relief. Fluid removal may reduce abdominal pressure and improve breathing or comfort. Albumin may be given if a large amount of fluid is removed. Lab. Fluid samples may be reviewed by the laboratory. If cytology is ordered, cells may be reviewed under a microscope. Reports will be sent to our office. Follow-up. Our providers will review the report in detail. The findings will be reviewed with you in detail upon follow-up. After your procedure. Recovery. You may be observed after the procedure. Your blood pressure and puncture site may be checked. You may have mild soreness at the puncture site. Avoid strenuous activity as instructed by the facility. Transportation. If sedation was not used, you may be able to drive unless instructed otherwise. If sedation was used, do not drive the remainder of the day. If sedation was used, you must have someone 18 years old or above to drive you home. No Uber Lyft cab if sedation was used. Symptoms. Normal post-procedure symptoms. Mild soreness at the puncture site. Mild bruising. Mild abdominal discomfort. Small amount of clear drainage. Feeling tired after the procedure. Abnormal post-procedure symptoms. Fever greater than 100, severe abdominal pain. Increasing redness, swelling, warmth, or pus at the site. Heavy bleeding from the site. Fluid leaking that does not stop dizziness or fainting, shortness of breath. Any other severe or unusual symptoms, please call 911 and go to the nearest emergency room. Appointment. Ensure that you have a follow-up 2 to 3 weeks after the procedure, or as instructed. Results. Your results will be discussed in detail. Treatment recommendations will be given. Additional liver, imaging, or lab testing may be recommended. Questions. Call or text GastroDoxs at 832-632-4070. Thanks for watching.